It's quite a intense disease, isn't it? Disease process. And I mean, in terms of, you may have them present and they're quite subtle, but you can have them present really, really unwell. And it can progress, can't it? So you talk about severity. Is this a life-threatening condition?
It can be a life-threatening condition. So most cases, well, a large proportion of cases will settle down with treatment. But there are those cases where the inflammation progresses and the inflammation becomes body-wide. It's a whole systemic inflammation. And that can lead to organ failure and death.
Hey, I'm Dr. Kara, the host of the Paws Effect Podcast. This podcast is all about bridging the gap between pet owners and pet professionals, offering expert insights and sharing stories to help you better understand and care for your pets. Whether you're here to learn, to be inspired, or to simply feel more confident as a pet owner, you're in the right place. If you enjoy what you hear, please take a moment to subscribe, leave me a review, or share the episode with someone who could benefit. Your support helps this podcast grow and continue making a difference in the lives of pets and their people. Let's get to it. A very warm welcome to Dr. Pieter Hanekom. Thank you. Back in the studio.
Thank you.
We've had some really cool conversations before, really important conversations. And I think that when I come across a topic that requires quite sort of technical explanations, I like approaching you because we see a lot of the subject matter today. And it's that time of year where we're probably going to see quite a lot of these cases. But you also have a really great way of explaining some of the processes and giving us good explanations for the listeners. So today's topic is pancreatitis. So can we start off first with a definition of what pancreatitis is?
Yeah, we can. So the pancreas is this glandular organ that sits right next to the stomach and the upper intestine. And its primary function is basically two things, making insulin, which obviously controls blood sugar levels. And we talked about that in the previous podcast. And its other major function is to make the digestive enzymes. So pancreatitis then just simply refers to inflammation of the pancreas and then the consequences of what happens when it becomes inflamed.
Yeah. And I mean, I was saying to this with my son, obviously likes the explanation of words. Anything with the itis at the end generally indicates inflammation. So colitis, pancreatitis, and so inflammation very much of the pancreas. And this is quite a common condition that we see.
Yes.
And sometimes one that's quite difficult to diagnose, and I'm sure we'll go into why. But why am I saying this time of year? What is it that happens during our summer months or the approach of the festive season that makes this condition so prevalent?
Well, I think the classic case of pancreatitis that we see is in dogs is when you've had a sudden fatty meal. And so obviously this time of year, people are partying, they're having braais, and the bits of fat or whatever gets given to the dog, and so those sort of scenarios are typical where we then get pancreatitis happening.
Yeah.
So that's probably the biggest reason why we get this a lot more cases this time of year.
Yeah, no, and it's incredible how familiar pets become to a particular diet and how used to their diets they become in terms of digestive, those enzymes you were talking about, and then that sudden change can cause a whole host of problems, vomiting, diarrhea, and then obviously
triggering pancreatitis.
Triggering it. So what is it that's actually happening? So if we talk about pancreatitis in terms of what is the disease process, so you're saying it's an inflammation, but why?
Why does it happen?
Yes.
Well, so these digestive enzymes are made in the pancreas and they are stored in the pancreas, but they are stored there in inactive form. They need to be secreted into the adjacent intestine, and then they're activated by an enzyme in the intestine called enterokinase, and this then activates those digestive enzymes to start doing their job, which is obviously breaking down the food so that it can be absorbed and used. So when these enzymes become activated within the pancreas, then you get this process of digestion that starts taking place inside the pancreas where it never should happen, and that then causes inflammation of varying degrees. Now, as to why those enzymes become activated, there's a little bit of a gray area, and there are a number of theories out there that try to explain why the pancreas may lose its protective mechanisms in stopping this from happening. But I don't think there's 100% clarity about exactly why. So we always people always ask, but why did my dog get pancreatitis, or why did my cat pancreatitis? And the answer is we really can't say for sure. We can think about it. We can list some predisposing factors. For example, we talked about the fatty meal, but actually we don't really know. And the short answer is we're not really sure how these enzymes become activated. It's a bit of a question mark.
And that's why when I read about it, it often uses the term idiopathic.
Yeah.
What does that mean for the listeners?
It's just a nice big word that means we don't know.
Yes. No known cause.
We don't know.
So obviously we know that there is some inciting things that may cause pancreatitis. We said the fatty meals. What are the other things that you can see pancreas result from as a sort of secondary condition?
Yeah. So basically any breed of dog, any age of dog can get pancreatitis. But certain breeds of dogs may be more predisposed. So, for example, miniature schnauzers are a classic case of a lot of them have a genetic defect in their fat metabolism. So they have too much triglycerides in their bloodstream, and that we know can act as a trigger factor for pancreatitis. So miniature schnauzers are extremely prone to pancreatitis because of that. Then there are certain drugs that may provide a trigger or can increase the risk of pancreatitis. The most common ones would be anticonvulsants like phenobarbital and potassium bromide. Also drugs like diuretics, furosemide, for example. Some antibiotics, like some sulfur drugs too, can predispose to pancreatitis. And then even things like trauma to the abdomen may actually cause a pancreatitis. And even infection with biliary parasites, babesiosis, is also regarded as a possible risk trigger factor for pancreatitis. So there's a whole bunch of things that might play a role. And in cats, the situation is actually even a bit different from dogs, because in cats, there is a link between inflammatory bowel disease and pancreatitis. And the thought is perhaps with inflammatory bowel disease, we can get an abnormal bacterial population in the gut, and some of those bacteria can make their way up into the pancreas and cause an actual infection of the pancreas. So there's a definite link there in cats. It's a little bit different. The fatty meal thing doesn't seem to be a big issue for cats. But
a little bit more discerning.
They are more discerning in what they eat in the first place.
Yeah.
But there's definitely a link between inflammatory bowel disease and pancreatitis in cats.
So one of the things I found really fascinating in both the experience of managing these cases, but also in the reading about it, is that you speak about the causes in cats and dogs being very different, but also the presentation of this condition. So what are the kind of signs that owners may notice, maybe at home, that may indicate that their animal has pancreatitis?
Yeah, very different between cats and dogs. With the dogs, the classic presenting symptoms are usually loss of appetite, vomiting, and abdominal pain. Now, we say abdominal pain, that might be a bit difficult for an owner to recognize, but we will. They may assume what's called a prayer stance, where they lower the front legs and raise the hind legs. You see that sometimes. Typically, it's abdominal pain. May be something that we as veterinarians will pick up when we examine that animal. So when we palpate that abdomen, they will be really, really tense, and they might even cry or complain when you do that. And in vomiting, they sometimes might have diarrhea, sometimes they might have a fever, but the main things are loss of appetite, vomiting, and abdominal pain. Now, cats, again, as we always talk about cats, they always make our life difficult because they're never easy, they're never straightforward. And in cats, pancreatitis is a very, very much more vague kind of disease. It could just be a reduction in appetite. And that may be the only sign. Could be a complete loss of appetite. Only about 35% of cats with pancreatitis will vomit. and only about 25% of cats with pancreatitis will show any abdominal pain. So it's much more subtle, and you got to put it on your list of things when you got a cat that, I like to use the term, ain't doing right. So it's just an ADR cat, it's just not right, and there's nothing else to go on. And then we have to look for it.
So let's talk about the looking for it, because this has changed. So, I mean, just to give the listeners or the new listeners some information, I obviously haven't been doing clinical work for a while. And in the days where I was doing emergency medicine and critical care, a lot of this was a rule-out diagnosis. You could kind of presume it was by checking that the other things were ticked off, and it wasn't those things. And I'd like you just to explain what I mean by that, and give some clarity, because there's been some progression in the way that we diagnose this condition, hasn't there?
Yeah, there has. Luckily, we've got some better tests nowadays. It used to be fairly limited, and we used to have some tests that might indicate, but we couldn't really be very sure about it. Even now, there's no one particular test that we're going to just rely on completely. It's a combination of the clinical symptoms, blood tests, and we'll talk a bit more about the blood test just now, and also ultrasound. So it's a combination of those three things. So the blood tests, we do now, luckily for dogs and cats, have something called a pancreatic specific lipase test that we can do. And they, in many cases, can give us a very good idea if we need to worry about this pancreas being inflamed or not. We certainly like to always do an ultrasound exam as well. Ultrasound exam is about, I think the figure bandied about is about 68% sensitive in picking up changes that we might see with pancreatitis.
What are the changes you look out for on ultrasound?
In ultrasound, so it's just changes in the texture that we see on the picture that it generates, for example, and you might see some swelling, enlargement of it, and so on. It can be quite subtle. Preferably it does need somebody who's got some experience in doing ultrasounds to know what they're looking for. But there are instances in where you won't see anything. You might, on the other hand, pick up issues with an ultrasound that might alert you to even bigger problems. So even bigger problems, if you see a really swollen, horrible-looking pancreas, then you know that you've got a severe inflammation, and you might expect that things may not be that easily treatable, and it may affect your prognosis at the end of the day. And occasionally you might actually pick up indications. There might even be more serious issues like pancreatic cancer.
So another reason why that pancreas could be inflamed.
Exactly.
Hi there, pet parents. This is Dr. Cara, the Ultra Pet Vet. I'm excited to introduce Ultra Pet's premium recipe for miniature and small breeds. Ultra Pet's smaller kibble size combined with calcium and phosphorus helps keep their teeth in tip-top shape. We've added omega-3 to support their heart function while keeping your little ones strong and healthy. Ultra Pet has included chondroitin, glucosamine, and green lip mussel extract to help your dog's joints, and L-carnitine to manage weight. Prebiotics play a crucial role in maintaining a healthy digestive system by nourishing the good bacteria in your dog's gut. The best part? Ultra Pet offers a 100% money-back guarantee. Visit your local vet or pet store to make the switch now. Listeners have also probably heard the term, if they've come across this, of acute and chronic pancreatitis. Can you help us understand what that means and sort of what it means for
so the inflammation of the pancreatitis, it can be acute, it can be chronic, it can be mild, and it can be severe. And you get a big variation there. So acute pancreatitis are those typical cases that the pancreas were perfectly fine and something triggered it now, and now they're acutely ill. The chronic pancreatitis is where you may have this intermittent periods of flaring up of inflammation, settling down, flaring up, settling down. And this can last for years sometimes. And it can result, in the end of the day, to fibrosis, permanent damage to the pancreas. And it may then lose the ability to do its job in either making insulin, and that animal becomes diabetic, or a loss of digestive enzymes, and the animal can't digest its food properly. But it is something that we see from time to time. Certain breeds of dogs are more predisposed, like spaniel. All the spaniel breeds are more predisposed to chronic pancreatitis.
And it's quite a intense disease, isn't it? Disease process. And I mean, in terms of, you may have them present and they're quite subtle, but you can have them present really, really unwell. Really ill, yeah. And it can progress, can't it? So you talk about severity. Is this a life-threatening condition?
It can be a life-threatening condition. So most cases, well, a large proportion of cases will settle down with treatment, and we'll talk about the treatments just now. But there are those cases where the inflammation progresses and the inflammation becomes body-wide. It's a whole systemic inflammation, and that can lead to organ failure and death. And unfortunately, we do see those cases from time to time.
And it's although they don't always show it, any inflammation, anything that people can see that's swollen or inflamed is painful. And so, yes, that obviously we'll talk about management of, but it's not a nice condition to have. So yes, let's talk about. So we talk about diagnosis. We now have determined, or we have a provisional diagnosis that we believe this is pancreatitis. What is our general approach to trying to manage these cases?
So generally, we will hospitalize these patients. We will put them on intravenous fluid, i.e. drip. That's important in keeping up the perfusion to the pancreas itself, maybe even flushing away some of those biochemical products, inflammatory biochemical products. We will give them pain medication. The level of pain does seem to vary. Of course, we can never ask our patients how much pain they're in. We know that pancreatitis in humans is a very painful condition. We know that some dogs certainly show a lot of pain. Some don't show as much pain, but they all will receive pretty serious pain medication. We're going to assume they're painful, and we're going to give them pain medication. We definitely will give them anti-nausea medication because they do tend to feel very nauseous. We'll make sure that they actually get some food. And this is something that also changed when I first qualified. We were taught to withhold food for a day, 2 days, so that the pancreas would have a chance to, in inverted commas, rest. Now we know that's not actually a good idea, and they should keep on eating. So we need to make sure that they do.
Yeah, they don't really feel like eating when they're nauseous and painful.
But we need to make sure that they get some food down there and they get their calories.
Absolutely.
Those are the three mainstays of treatment. People also often ask about antibiotics. The more recent thinking is not to use antibiotics necessarily. There are cases where we might use antibiotics if we think that we have a more severe situation. We might do it, but as a routine for mild to moderate pancreatitis, we don't routinely use antibiotics.
Yeah, it's not bacterial generally in origin. So.
Yeah.
And in terms of how long do these cases generally stay with us? What do you say in terms of managing owners' expectations as to?
So, in our experience, it'll be a couple of days, maybe even a week. And then there are always exceptions to that as well. But we've got to be ready for at least a couple of days in hospital.
And what are the indications that they are potentially ready to go home?
Yeah, we're happy when we see that they're not vomiting and they've regained their appetites and they don't seem to be painful. And ideally, one can repeat some of those blood tests and have a look. It's always good from our point of view to do that. There's also a little test that we sometimes do to check the level of inflammation in the body, and you can do serial checks on that, and it's very nice to see if that's coming down. The inflammation is settling down. In reality, the funds are not always there. It can be an expensive exercise. Going intensive treatment in a hospital can get expensive, and clients don't always have the funds to pay for all of those things. In an ideal world, we love to do all those things.
Yeah. And so often we have owners who are kind of pushing us to get their pets home, both because they miss them and they've got financial...
So we are often financially restrained because we have to work within a certain budget or estimate.
Mm-hmm. So they're going home now. What is the way that you advise owners can best support their pets in terms of managing the current disease process and preventing it recurring?
Yeah. So certainly for dogs, we got to stay away from anything fatty, oily kind of meal. So never again can we have that bit of braai meat from the from the party. And luckily, there are special diets as well nowadays, low-fat diets, which makes it very easy to just use one of those prescription diets, and you're sure that that's going to be okay. So in cats, it doesn't really seem to be that important. The fatty meal thing doesn't really seem to be a big issue. But we mentioned the inflammatory bowel disease, and so for those cats, it's probably more important to maybe think about something like a hypoallergenic diet. Going forward, we know that dogs that have had pancreatitis once are definitely prone to getting repeated episodes of it. So for us, generally, we would advise that if they had a bout of pancreatitis, that they should ideally, playing it safe, just keep them on a low-fat diet for the rest of their life.
And we're then obviously advising owners of what to look out for in the events, rather than it becoming something that they're seeing quite late and then needing very intensive treatment for.
First sign of, feeling nauseous, vomiting, that sort of thing. Let's check. And if we had a case that we know they had pancreatitis, 6 months ago or a year ago, the first thing we're going to do is going to recheck and see if it's flared up again.
Oh, very much so. So then we obviously have had development in terms of the diagnostics and treatment of pancreatitis.
Yeah, so treatment-wise, that's what we forgot to mention. There is a new drug that's just been approved last year in America. It's not widely available yet, and unfortunately, it's not available here.
It won't be for a while.
We would love it to come this way as soon as possible. So this is quite an interesting drug. It's an antibody-type treatment, and it specifically targets the actual inflammation that's taking place in the pancreas, and it seems to be really, really good at treating patients with pancreatitis and at the very least shortening their stay in hospital. So we're waiting with bated breath for it to arrive on our shores.
And in terms of owners, is there something that they can do at home to manage these cases? So say finances are prohibitive. Is there anything owners can do in terms of supporting their pets if they can't? Or can they give pain relief at home? Or is there a way you support your owners who can't hospitalize them?
Yeah, well, look, we obviously always advise what we think would be the best way to treat. But again, if we're constrained in that, then we have to go to plan B or plan C. And yes, so we will try and treat them as outpatients. And yes, again, pain medication, anti-nausea medication, perhaps some fluids that can be done under the skin subcutaneously, that sort of thing.
So that leads me to if it is something that progresses and owners obviously saying, look, I'm not winning this. I've got financial sort of constraints, but this is now my dog's really, or cat's really not well. What actually happens in those severe cases that can cause that progression to a point where you may lose them?
Yeah, well, we talked about that inflammation that spreads and become system-wide or body-wide. And so those cases then can develop multiple organ failure. So we just see these guys getting worse instead of better. And then obviously we can do some more testing and look at the other organs and so on, and we can get an idea of where we are. It's hard to predict which patients may go down that road and which won't. I don't think there's any exact way to say. But it unfortunately does happen that some patients deteriorate despite whatever we try and help them with. Because again, we mentioned this drug that's become available, but apart from that, and even that, it's not a golden bullet to treat pancreatitis. I always tell people, they often ask, well, how are you going to treat? And I say, well, there isn't a magic pancreatitis medication. There's no bottle of pills that says pancreatitis on it. All the treatment is supportive and trying to help the body to cope with what's going on. Ultimately, the body itself has to take care of that inflammation, and its own immune system has to deal with what's going on. We're helping, but it's not it's not the silver bullet to fix it.
No, absolutely. And I think that's a really important information to share, is that this isn't sort of actual treatment this is supportive treatment, and often, the treatment that we give for other conditions. And that's sometimes why some of these cases go undiagnosed as such, because there may be prohibitive sort of factors like not being able to run bloods or not being able to do an ultrasound, and you've got to treat it sort of as though you would any other condition and support what you're seeing. So support the fact that they're not eating with fluids and syringe feeding and so on. So yeah, this is like it's that, like I said, this time of year we seem to get a spike in them,
and avo season.
And avo season, the fatty avos.
Some dogs will sit under the tree and they wait for those avos to fall. And as they fall, they'll eat them. Yeah. And some dogs seem to be perfectly fine. They just gain a lot of weight because they get so fat over avo season. But there are the other ones who get pancreatitis picking out on avos.
And I mean, the pancreas, when you talk to anybody who's learning to do ultrasound scans, they'll go like, I just want to be able to identify the adrenals and the pancreas and know. And obviously, when you have a condition that causes any inflammation, that kind of can make those things a little easier to look out for. So in terms of supporting vets who want to become better at diagnosing pancreatitis in their pets, how much can you rely on X-rays and your clinical examination?
Yeah, X-rays are not really helpful. I mean, occasionally you might, if it's severe inflammation, you might get fluid accumulation and effusion in the abdomen, and you might pick that up on an X-ray, but it's still not going to tell you where it's coming from. So X-rays are not really useful. As I said, ultrasound can be very useful, and sometimes we might get some vague cases where we're not necessarily even thinking about pancreatitis, but we do an ultrasound scan and we see the pancreas looking abnormal. We go and do the tests afterwards, and we can get some confirmation there. So sometimes it's the other way around. We'll do the scan first and then the blood testing. Otherwise, we'll do the blood testing and then the scan. But it remains a combination of combining your clinical symptoms, your blood tests, and your ultrasound. Ultrasound's not always easy. I mean, that's why it says 68%, but that 68% sensitivity for diagnosing pancreatitis is really for experienced sonographers. It's not for somebody who's not very experienced in abdominal ultrasound. Can be a difficult organ. Sometimes you get a lot of gas in that area, which obscures your picture. It's not always an easy thing to scan. But you should always do it. We always make a point of
checking
doing it, and the only time we're not going to do it is if there are financial constraints and we can't do it for that reason.
And I don't want to miss the opportunity to ask you, why would it not be advisable to go in and look at the pancreas?
Well,
I mean surgically, sorry, yes, for the listeners.
Sure, surgically, yes, yeah. I mean, there are instances where we advise doing that. So again, if we have those cases that are not responding as we would expect they're going to respond, and particularly those cases where we may see some more stranger anomalies when we do the ultrasound, then we may advise, look, this maybe we need more answers here. Maybe we don't have all the answers, and the only way to get a more definitive answer is to go and take a biopsy of those pancreas. But it isn't something to be taken lightly, because these animals are going to be really sick. And now you've got to anesthetize them, cut open their abdomen and put them through a fairly big surgery.
Dropping their blood pressure.
While they are in a very sick state. So we don't take that lightly, and luckily, thankfully, it's not too often we have to go down that road.
And probably my final question, because I know we're running out of time. How often do you see secondary pancreatitis associated with abdominal surgery?
Oh, that's a good question. I don't really know. I don't think we see it very often. If we just think about routine abdominal surgeries, spays, for example, obviously a lot of those get done by vets, and I think the chances of getting pancreatitis through something like that is it must be very slim. There's some instances, I suppose, where the risks will be increased. Say, for example, you've got a dog with a foreign body obstruction in the intestine, and you are manipulating the intestines during your surgery, and perhaps in the area of the pancreas, you're physically manipulating the pancreas themselves or the adjacent intestine. Then I would think, yes, the risks will be increased.
But normal surgery shouldn't?
Yeah, normal routine abdominal surgery like a spay operation, not worried about that. Right?
So when we're advising post-surgical procedures like that for owners to feed, say, like a bland meal or to keep fluid therapy up, I mean, that's just really in order to support gut health rather than any risk associated with pancreatitis.
Yeah, I think so.
Absolutely. No, sorry, this is great clarification on the condition. Obviously, feel based on what you're saying, the take-home message is to try and get a diagnosis as early as possible and manage it quite intensively, because that can definitely reduce the period of time that they have to be hospitalized, and that it's not to be taken lightly, because it can be something that progresses, particularly the first time too.
Yeah, it's always a serious diagnosis. It's a serious disease, and it has to be treated. The treatment is fairly intensive, but it can be serious and even fatal in some cases.
Thank you for your expertise again. I find it a really interesting disease process. Not obviously it's dreadful, but just for us to best support, just because it is something that you can't always pinpoint. So it's one of those, where you've got to be curious enough to be looking for and actually have that in the back of your mind as a possible differential diagnosis in multiple cases that you're seeing, that kind of vague presentation of inappetence and vomiting and diarrhea. It's always sort of...
Which could be a lot of other things. It could be a simple gastrointestinal upset.
Yeah. So not to go, it's just got it just off its food for a day. It could be something that's more serious, particularly if they are adopting a strange posture or showing that they're uncomfortable or panting, anything that could indicate that they're in pain. So really important. Thank you for taking the time to talk to me about it.
You're welcome.
Thanks. Thank you so much for tuning into today's episode on the Paws Effect Podcast. If you found the discussion helpful, please like, share, and follow our podcasts. Don't forget to leave us a comment or review. We love hearing from our listeners. Remember, you can listen to us on your preferred podcast platform. Welcome back to Just for Pets. You're with Dr. Cara.
Hello, Doctor. It's Chanel the Persian. And, I can't seem to stop retching to get this hairball up.
Are you on a special diet?
Excuse me?
Hairball control food will really help. And maybe some Laxapet. And lucky for you, Just for Pets have a big range.
Well, how early can I get some?
Order today and we'll deliver pronto.
Wow, I feel better already.
Justforpets.co.za. Vet approved, pet adored. Get it all to your door.